Both. Before and after, super, super critical components to a successful release. And any amazing release provider will tell you just that. We are very blessed to work with really great release providers who will not do a release on you until they get the green light from us. And the reason for that, I feel like the after therapy makes sense to people, right? Like you wouldn't get a knee surgery and then not go to physical therapy for that. And we need to make sure that we're assisting in proper healing. Now, the before therapy, I think sometimes that's where people get confused. Like, why do I have to come in before? And that part is super critical, again, for the release provider so that they can get an optimal release, a more successful release. It's almost like we're priming this tissue. We're already starting that neuromuscular re-education. We're working on some of that fascial restriction. Remember, we talked about fascia connects from our head all the way down to our toes. So the therapy before, it's not that we're stretching that frenum, right? You can't actually stretch that piece of tissue, but we're working on some of that muscle control, gaining some strength and control so that when you get this, wait, Joanne, I want you to say your analogy with the dog.
Well, after we have our release, we want our tongue to heal so we have maximum mobility, right? So we never want to, if we cut ourselves and our cut is open, our tissue is always going to want to close. So just like that with your tongue, if we're not doing stretches and we're not doing exercises afterwards, we can't get that proper healing and all the motion and range of motion that we need with our tongue. So Brittany's analogy is always that we want to close the curtains, not the shade. We don't want the tongue to come down and heal this way. We want it to heal this way. So it's got maximum range of motion. Then after that, your tongue doesn't know what to do. Your tongue's been tied to the bottom of your mouth all that time. So now it's kind of like having your dog in the front of your yard and taking it off the leash, and your dog doesn't know not to run in the street. Your tongue doesn't know what to do. It doesn't know that it has to be in the top of your mouth. So we have to train these muscles now and teach it what to do so that it works properly and you have proper function.